Welcome to this first live session, panel session, and it's a great pleasure to be talking with our global audience on this issue, and also to have our panelists who I will give a few minutes to in fact introduce themselves. And please refer to the program for their extensive bios. Initially, when we planned this session, we were planning on having a face-to-face session in Australia, in Melbourne, and we were also planning to, in fact, talk about the remarkable digital transformation that is being occurring across so many industries and so many sectors, and in fact actually explore how this digital transformation could be accelerated into healthcare and to bring light to those. So digital transformation is already occurring at record pace. The health industry has always been challenged, and a lot of those have been the complex issues and the complex systems that exist in healthcare. But what came to us at the start of this year was a live test and a lived experience of essential digital transformation of a healthcare system. And we're going to explore a number of those wins, a number of those challenges, and also a number of, in fact, pitfalls through this panel as we move through. So I have it's my pleasure to start with some of our introductions as we move through, and I'll hand over the microphone to Karen Holbrook to actually give us a brief understanding of who she is and what she's actually doing at the moment.
Thank you. Thank you very much, Bob. I am echoing. Can you hear it? Do you hear the echo?
It's actually fine, Karen. Okay,
all right, that's fine. Now it sounds good. Anyway, I'm Karen Holbrook. I'm the Regional Chancellor of the University of South Florida, Sarasota, Manatee. And what I'm actually doing is leading a university right now that's just undergone consolidation with two others, so that we are now 3 universities and trying to pull us all together. As far as what I'm interested in, I'm really a biomedical scientist, a cell and molecular biologist from years past. But most recently, I've been much more interested in artificial intelligence and emerging technologies and cybersecurity.
Fantastic. And Mary Foley, if you could tell us who you are and what you're actually working on at the moment. Mary, you're still muted at the moment.
Sorry about that.
Excellent.
Thank you, Rob, and thanks everyone. Yes, I'm Mary Foley, and I'm the Managing Director of Telstra Health, which is Australia's largest digital health company, and we are owned by Telstra, Australia's largest telco. And my own personal background is a long one. I more than 40 years in healthcare. In healthcare delivery, leading large public and private systems in different parts of my career, also at the government end in policy, and also in academic roles. I'm a professor and teach at teach health systems and how you structure them and how you finance them at the University of Western Sydney, and I enjoy keeping my hand in there. Of course, all of us involved in healthcare have had an amazing year this year with the pandemic. And when it comes to the response of health sectors and how they've had to rally and stand up, both health delivery and public health services, we've had the opportunity to be right in there in various ways, because we serve right across public and private hospitals, Indigenous healthcare services, community and primary health, pharmacies, residential aged care and community aged care. And we also have built and operate some major whole of nation or whole of state jurisdiction population health platforms, the National Cancer Screening Register for bowel and cervical cancer, and also real-time prescription monitoring platforms for prescription drugs of addiction. And then we have our health analytics business, Dr. Foster, which is based in the UK. And of course, they've had huge demands for data insights during the course of the management of the pandemic. Our interest in what we've seen is, and my absolute passion.
We might actually come into that, Mary, when we explore on the panel.
Okay.
I'm going to cut in on that, but I will come back. Now, one of our panelists, Ron Indek, is still being challenged by our platform, and I just sort of refer back to this as that the challenge of doing this is the future. Is you're on mute still? Is the catch cry of 2020, and I think that'll actually be something that'll be emblazoned on all of our T-shirts into the future. Now, great pleasure to introduce Stefan Hatchkowitz, who works as part of Cyro's team in our data business called Data 61. So Stefan, just give us a little bit of a background on who you are and what you've been doing, and then I'll roll into start the panel questions that I've actually prepared from here, if that's okay.
Yeah, sure. Thanks, Rob. And I've also seen those T-shirts. I'm on mute, or you're still on mute. So it's definitely the catch call of 2020. But thanks very much. I'm a principal scientist in strategic foresight in Data 61, the digital science agency. We have about 1,000 staff across all fields of science, digital science and data science. My team does a lot of work on strategic foresight into the coming 5 to 20 years, which during the COVID crisis has become months and years because, a year's worth of change is being packed into every week during this time. We did do the national roadmap for Australia on artificial intelligence and the ethics framework as well for artificial intelligence from my team. So we do a lot of work on digital strategy and policy and what it all means and how to adapt to this new world of digital. So really happy to explore some of those themes, and thanks, Rob. Great to see you.
Yeah, fantastic, Stephen. So when Ron does join us, and I do hope he does, because he's a regarded international expert in cybersecurity in this area, so I do hope that we can get him online, which we will work. But I'm first going to hand over to you, Stefan, because some of the work in what we call megatrends, and to explain the megatrends, but even the megatrends we are seeing in digital is a way to actually set the scene. And then perhaps we just start to move into how these megatrends have been changing in the face of COVID. If you could, in fact, enlighten us a bit on some of those thoughts you had going, well, let's just say pre-COVID, where you were sitting first.
Yeah, thanks, Rob. So the concept of a megatrend comes from a US academic in economics, John Naisbitt, who published a book of the same title back in the 1980s. And we've really developed and sort of built methodology around that concept and have used it extensively over the last 10 years in CSIRO and found a lot of impact through that work. It's about gradual change that eventually hits us, and something like COVID-19 happens with a backdrop of a lot of change happening around it, about human mobility, about the rise of zoonotic illness. And it comes together and gives us this event. So we've applied the methodologies to look into digital technology, and I'd say it is fair to say within the COVID-19 era, we've seen about 10 years worth of digital transformation happen in the space of months. Colleagues of mine in the university sector who had plans to go fully online with their courses by 2030 are doing it now, for example. But large Australian corporations are really doing a very similar thing. Everything digital, a lot online. We've seen an absolute explosion in telehealth. The lines have been flat on the graph until we hit COVID, and they go up. And talking to people in the healthcare profession, doctors who have a long time been quite share of telehealth and by necessity have had to do it, I think it comes back. A lot of the scenario planning we're doing at the moment in COVID-19 is a rubber band scenario. We've been stretched into a new space. Scenario one is it snaps back. Scenario two is we stay somewhere new. And I think telework is the other really big one that is, I think, starting to have effects even on property markets and real estate as people are making longer term lifestyle adjustments. But we've had this incredible experiment about what's possible. So ultimately, digital technology has played a really critical role in keeping Australian businesses operating, keeping people in work and doing work, and keeping the healthcare system operating. But it's also given us a chance to test what we've seen. And then lastly, I think technologies like artificial intelligence, just as electricity was really important for the world to escape the economic depression after the Spanish flu in the roaring 1920s, where things rapidly turned around and grew. The general purpose of electricity is analogous to the general purpose technology of artificial intelligence, which is getting into absolutely every field of science, every part of industry, everyone's careers, and it's lifting up productivity. The escape from the COVID-19 crisis economic slump, I think, is productivity related. It's about doing more with less and becoming more efficient. Digital technologies and artificial intelligence will take us there. And I think there is, if we analyse history in the post-Spanish flu period, in the roaring 1920s, there is a positive story for us to take away from that about what's possible today.
Look, fantastic to have some positive story. Karen, I know that you've devoted so much of your professional career in all things digital and technology. What do you feel or at least how health has been changing in the digital transformation, or more broadly, how and what we're looking at with regards to the digital transformation. And probably the question, do you echo Stefan's thoughts that we're moving into the roaring 20s again?
Good question. Actually, I would be sort of a fake if I said I had spent my career doing this. I've really spent my career in higher education and biomedical. This has just been a hobby of mine recently and something I've gotten extremely interested in and spend most of my spare time reading about. So it's something I like. But you asked the question is, how has it changed? When I go back and think about my own career, I was at the University of Washington for 25 years, and I was in dermatology. And in dermatology, all the way back 25 years, actually more than 30 years, we were doing telemedicine then. And it was very popular for dermatology to get to Alaska and get to remote sites and the kinds of things. So this is nothing that is terribly new. And then we went on to radiology that would take images off ships and bring them back into the university. Then we moved into robotics and robotic surgery going into health. And I had the privilege of sitting in on robotic surgeries where they were doing them live right there in the hospital, but also they were doing them remotely. So technology has kept advancing all the time. But right now, I see that I think we're at a very different place, and I'm sure we all think that, where there's really a health IT ecosystem that's been really transforming, or I would say it's already transformed pretty much everything what we do in healthcare. And the kinds of technologies that we are seeing are so much with artificial intelligence, machine learning, robotics, blockchain, the Internet of Things, and all of those fit into a very broad spectrum of healthcare. When you think about artificial intelligence, you can bring in things like computer vision, where you image cancer cells to train your algorithms so that you can detect specific cancers. Images of people with genetic diseases, so you can identify genetic diseases. Natural language processing, where you can take free text and put it into electronic health records into standard code. Speech recognition, data mining for all kinds of patterns of diseases, prediction, unexpected behaviors, to evaluate, predict treatment programs, track outbreaks of infectious diseases. There are just so many applications in healthcare. And then you can go on to robotics, and not robotics, but chatbots. And chatbots who serve as not nurse practitioners, but they serve as individuals who work with patients. You've got healthcare blockchain that brings together records, not only the records of one person into one blockchain for the individual himself, but brings together de-identified health records and put them together into very large, huge blockchains so that you have modules that you can use for clinical studies and for all kinds of ways of identifying diseases and different kinds of things. And then I'll stop in a minute, but then you have all of the Internet of Things, where there are wearables and implantable devices that are so valuable in picking up health information from individuals and transmitting it back to a hospital, back to a healthcare person, back to yourself. So there are so many technologies now. All of those things are things pre-COVID. But with COVID, they've all switched into something else. And so I'll stop at this point, and maybe someone else wants to pick up with that. Because I think all the digital technologies are being affected in so many different ways. And I'll say one more thing and then I'll stop. I think it's been so exciting to watch universities right now, because all universities are using their innovative skills, their engineering skills, their medical skills, even their social skills, to think about how do you use a technology to make a big difference in the COVID environment. And the things that are coming out of it are amazing, such as developing a nose. One of our engineers has developed what they call a nose with special arrays that can detect different molecules from the breath of people. So there are so many things that are really very exciting today.
Look, I think, Karen, you've given me goosebumps thinking about the excitement. Stefan set the scene that is all positive, and I can see ourselves learning how to do the flapper dance, and you've actually just ignited us into all of the science fiction films we've grown up with. So it's very exciting. Now, Mary, it's probably your job as somebody who's been a Secretary of Health and now leading Australia's biggest digital health company, to in fact give us the reality check about some of the challenges that you're facing with regards to how we might realise these fantastic remarks that have been made by the previous panellists.
Thank you for throwing me that question, Rod, and it was very exciting to listen to Karen and Stefan. In the context, we've been sort of down at the coalface with responding to COVID and providing to both governmental jurisdictions and health service providers, both at the individual level and system level, how to actually use the technology that is already there and around, and the extent to which clinical information and patient information and demographic information connected to that is digitised in various systems around Australia, and to look at how that could be mobilised and mobilised quickly, either to respond directly to management of the pandemic, or to ensure health systems could continue to function and that people could access needed healthcare that otherwise the COVID lockdowns and the challenges on hospital systems particularly, as to how to get health services to them. What we've found in that process is that Australia is, after many decades of development, but with government-led, but also industry-led, and most importantly, clinician innovation-led, lots of the building blocks needed for that have been there. And the challenge has been to how to mobilise those quickly to be able to stand up things like our pharmacy business that provides clinical dispensing systems to a very large part of Australian retail pharmacy. Got a call from the federal government saying, what would it take for you guys to accelerate having completely paperless scripts? We already have electronic script exchange, but it still requires people to end up with a printed out piece of paper and to see the doctor, go to the pharmacist and so on. And yes, we had to do some pretty clever technical things and run shifts of developers to do that in a matter of weeks. It's a process that would have normally taken much longer than that. But similarly, the most important part to making that happen, and it did in a matter of weeks, so that we probably got that call in late March, and by May we actually had the first example of that system operating, and now it's spreading right around Australia based on that prototype. But the biggest solutions we're having in this country as a federation, having federal government who looks after payments for retail drugs and subsidises them for all Australian citizens, and the state systems that regulate pharmacy, and particularly sort of the Schedule 8, they're called here, drugs, the more dangerous drugs and so on. We instantly, overnight, had to have them come together, develop consensus, both and harmonise the legislative framework and the process frameworks about how dispensing was regulated in very responsible ways. And we would have got there normally with a lot of intergovernmental meetings and intergovernmental meetings and with industry and so on. And instead that all happened in the matter of a week, so that the developers could then work shifts and actually put that extra connecting technology, which built on technology that has been in place in this country for over a decade, that had started to get electronic transfer of scripts from the prescribing doctor's desktop system, whatever system that was, to the retail pharmacist dispensing system, whatever system that was. So then by quickly adding some simple pieces, we didn't have to use AI or blockchain or any of those things. They are very important parts of what's coming off, once we've got these platforms and ways of doing things. But it was some very simple, basic things at scale, backed by the regulatory environment, that allowed that to happen. And I think to get that realisation of the possibility of how digital solutions can and will be really transformative to medicine, really transformative to healthcare, and really transformative to public health of communities, is about being able to take all this emerging technology which is there, look at the systems where they are, look at clinical practice, look at the regulatory environment, looking at the funding flows. there was no point having a paperless script if the payment mechanism wasn't going to subsidise patients for it, for example. It's about getting all those things to work to really make the big leaps forward. And what COVID provided, while it's been a great tragedy for many people and a great stress on our systems, it also created this environment where we all just had to work together and look at scale. And that has been a powerful, created powerful momentum for having systems that are far more connected and thinking really cleverly about using data that's in the multifarious systems that are already there.
Yeah, look, Mary, I'm going to pick on some of the themes there. One of those was funding streams. The other one was engagement of workforce, engagement of, in fact, actually the patient or the general community. The other one was the systems. You've mentioned regulators as well. But one question that we've got from the audience was looking at innovations in contracting to actually work in this area, because this is one of the challenges we've had. And I think I'll open this to all of the panelists, because one of the throttling points for say, if you've invented something that actually works and also you want to in fact actually enter a system in this sense, because we've seen rapid changes, and the next panel will talk about vaccines, which is close to my heart, about how we've just completely thrown the rule book out and we're in fact changed at warp speed in a sense to actually develop these. So, look, any of the panelists with your thoughts about the challenges there, say, for how to enter this work, how to, one, contract in, or even how to, in fact, actually invest into this change is certainly one that our audience is very keen to understand.
I'm going to first go, Rob, having lived through this during this time. And yep. It's been particularly had to be addressed in COVID, but will also be part of future contracting. And I presume you mean contracting with suppliers of systems? Is that what we're talking about?
I'm looking at the fact that I've sort of merged two questions we had. One was innovators getting an entrance into to what's happening. So we're in a sense looking at a bit of a gold rush for digital health, if we wanted to put it in that perspective. In a somber event behind it going on. The second is how, if I'm innovating, how do I enter the system? The other one is if I'm actually contracting or wanting to work in the system, how do I enter? And the third one is if I'm an investor, how do I get a piece of the action? Which is really certainly looking at the hard-nosed part of commercialising our great innovations.
Well, I just say in terms of the challenge has been interesting. We all hear about agile, but that way of co-creation and iterative development of software, rather than some IT specialists beavering away in a back room, creating a huge system and then saying, here it is, it's wonderful, and then a massive implementation. Agile models evolve the software, evolve it more quickly, and do it in co-design with the people who are actually going to use it, which, you know, a hospital emergency department setting is people who actually clinically work in an emergency department, for example. The typical form of contracting, particularly for these large system solutions, they're more likely to be, certainly in this country, procured by governments at all levels, and then you're into that very strict contracting model that is much more about that old model of something fully developed and commissioned off the shelf, or have it developed at arm's length to the specifications in the contract. What all parties are having to learn how to do is how do you have that discipline around procurement in these environments, but be able to have co-creation, absolutely essential, and to be able to move incredibly rapidly to respond to the emerging crisis. And that's quite difficult, but it's something that everybody's been willing to work on and find different ways that a process and it can be held accountable, but it requires quite different ways of conceiving of contracts and the administration of contracts, and even the way procurement happens, that it's very much an integrated exercise between the people seeking the service and the people who can provide the service.
Excellent. So Karen, your thoughts on this, because this is a very meaty question.
Yeah, I was going to go with one other piece that's a little bit different than what we've talked about, and that is the national investment in healthcare technology. I think it's been known for a long time that the United States is tops in highest in investing in healthcare technologies, but there's been a great push from the United Kingdom and from Canada and from China and India. All four of them are now investing very significant sums of money to make sure that healthcare technologies rise to the top of what they are doing in their countries to promote the technology, as well as to help people prepare for training. Training and workforce development is a very important area of that.
Yeah, and look, Stefan, you've been looking across many industries in digital transformation. Is there any other industry where we could learn in this setting that would actually assist us in developing and incorporating this in? I know that you and your team have been working across a multitude of industrial sectors and looking at digital transformation. Any tips or anything that we could look at to answer this question?
Yeah, thanks, Rob. And you know, health does feature in a lot of what we do. It's so important to everything, but from the large tech corporations, I think there are some things we can learn in the healthcare sector around human-centered design of information technology systems. My view would be that where we have seen failures of information technology systems, which have had a lot of investment, is that they haven't put clinicians and human beings, the staff, at the center of the system adequately, and they've built a technological solution without adequately putting the humans into it. So human-centered design in the digital area is something that's growing, is something that's really important, and I think that will be there for a while. I think as we look forward in sort of upgrading the information technology capabilities of healthcare in general, there is a huge opportunity to learn from this experiment, which was COVID-19, especially around telework. Even just talking to individual doctors who have shifted from one mode of operation to a new mode of operation, I think I've had a couple of those conversations, and it's been quite revealing to me about how they found out what was possible. And then lastly, around the human-centered design problems, you know, the technology is really important and we need to invest in it. But a lot of it is fairly simple human interventions. Preventative health still gives us these incredibly good benefit-cost ratios in the healthcare system for so many: diet and physical activity. Technology can help with that, but technology synced up with the human beings we're trying to influence towards more healthier lifestyles. So that's something that, you know, part of my background's in economics, and I keep on looking at it sort of benefit cost analysis angle. And preventative health keeps on coming up as such an incredibly good way to spend your money, if you can believe it. So, you know, Karen mentioned some of the wearables that I think are important and can help, but I'd say the full return on our investments in digital technology and healthcare come from a human-centered approach.
Mm-hmm.
Yeah, excellent. Karen, do you want to add some more to that, because he's led into some of the points that you actually made? And just remind us, we've got 3 minutes left to make some final remarks, actually. So one of the challenges for Ron, and I'll just send Ron's apologies for being unable to meet this, and I'll quote Ron. He said, "You know, you've got serious issues when the tech guy can't even help you out." So it's a shame we haven't been able to cover the cybersecurity area, but I think we've actually covered enough areas already in this panel. But Karen, I'll hand to you for some brief thoughts.
I would just say something that I think is really particularly encouraging and exciting is where education is going to prepare more people, not just for healthcare technology, but for technology in general. I have absolutely been amazed at seeing what's going on now in the grade schools and going up into high schools of preparing young people for emerging technologies, for doing things with artificial intelligence. There's a county in the state of Pennsylvania where they are starting AI for kids in the grade schools, in the very lower grades. And there's also a global competition for children in AI all over the world that takes place in Pennsylvania every year. And then I'm very excited about the new global university in Abu Dhabi. That's the Mohammed bin Zayed University of Artificial Intelligence that is particularly focused on that. So I think these technologies are building in all of our educational institutions, and many of them will go into healthcare technology. Many of them already are interested in both medicine and in technology. So I think the future is very exciting.
Great. So Mary, any final thoughts about where we might be at the end of this calamity?
Well, I think we'll have learned a great deal, and I think health systems by necessity and with everyone mobilising around them, as I explained, to support that to happen, have moved to whole new ways of delivering care. And I don't think any of that's going to suddenly go, oh, it's all over now, we'll go back to the way we were. A tremendous amount has been learnt, particularly by patients and clinicians, about how things can work. And then the onus for us in the sector that produces the material that can support them and enable them is we have to shift gears as well to look at how we apply that technology and what the problems are we're going to solve. It's no longer just about changing paper to electronic means of storing and getting information within a health setting. It's now much more about what's there, what can we use, and how will it really make a difference to patient lives? And we've got that merging between the community and inside institutions in healthcare, which has been necessary to solve the pandemic issues and contain it and treat it and manage. And I think all of that has taken us to another level as a health system, and seeing the importance of health delivery as a system that can, and digital has a key part in connecting up all those very complex moving parts.
Thank you, Mary. So we're actually getting wrapped up here, which is the unfortunate part of being a virtual panel. We've covered, look, if you're not excited by something that's coming out of the ashes of something horrific, you probably weren't listening to the presenters on this panel. I would really like to thank Karen, Mary and Stefan and Ron in his absence for, in fact, actually providing us with a positive outlook into where we might move with regards to innovation, particularly in the digital applications of the healthcare system from this pandemic and into the future. So thank you all for watching, and thank you all to the panelists for your fantastic and enlightening points that you've made today.
Thank you.
Thank you very much. Thanks.
Thank you.